What do you do when this happens? Or when someone gets minimally injured and there's still a mess to clean up? Well, that's what I'm here to tell you, because you being emergency first responders are going to be the ones that have to come and clean this stuff up. Well, first you need to put on proper protective equipment. This includes eyewear, safety glasses, and some gloves. That way you don't get bloodborne illnesses, contracted anything from the flu to tuberculosis, or anything worse than that nobody wants. That can be contacted through blood. And then it's also recommended that you wear a mask and a gown, but it's not required by OSHA. And without that, you could contract really major diseases and things that could affect you for the rest of your life. So they're very important. Secondly, you need to evacuate everyone from the area. That way nobody else gets illness or anything, and nobody else is in contact with the blood that is not properly prepared. Then you need to attend to the person who has been injured and attempt to stop the bleeding if you can. You can use a absorbent cloth or something to stop the bleeding. Put it on there, tape it on there, whatever you gotta do. You can wrap it up, elevate it, put ice on it. Just try and get the bleeding to stop. Call 911 immediately, and if they have hit their head or lost consciousness, you need to attempt to try and wake them up. Do not move them if they have hit their head or lost consciousness. Try to use common sense until paramedics or EMTs get there and can help you out. And then you can take over the rest of cleaning up the blood and everything. In order to do that, you need to mark off an area with cones or something of the like. That way everybody knows to kind of stay out of that area. Use trash cans, use whatever you need to block off the area. Then you need to place a barrier down to keep the blood from spreading. This could be something such as kitty litter or sand, dirt if you're outside, anything to keep your mess smaller and less for you to have to clean up. Otherwise, you're going to be cleaning up a larger mess than what you had to begin with, because blood is messy and it gets everywhere. Then you need to clean up the blood with disposable towels, and after you've cleaned up the blood with the disposable towels, they need to be placed into a biohazard bag. And the bag needs to be marked clearly biohazard, and it's generally orange or red. Then you need to mop up with bleach water. This is typically made by mixing 5 parts water with 1 part bleach, just normal household bleach, not industrial bleach. Otherwise, it'll be too strong. And then you might end up passing out along with your victim. And that isn't going to be any good for anybody. You're not going to help anybody. So, then after you mop up, the blood has been cleaned up, and then you need to sweep up any broken glass or any other potentially hazardous things that can hurt employees or anybody else in the area. Make sure that's all swept up, mopped up, taken care of. After that's complete, you can allow people to come back into the area, and they can continue working as long as the machines have been cleaned up and free of blood, and the area's been completely decontaminated, and everything's been taken care of appropriately. Then you need to make sure that you disinfect everything that you used, everything from the mop to the bucket to everything. Make sure anything that could be anything that can be thrown away, just throw it away into the biohazard bag, not into the regular trash bin. If you throw it away into there, then you're risking other people's exposure to the bloodborne pathogens. So it's very important that you place it into the biohazard bag, again labeled red, normally with red letters, or it's a red bag and it clearly will say biohazard on it. After that's all done and everything's been thrown away, cleaned up, thrown away is the best way to prevent it, but if you need to save it, disinfect it really well with bleach water again as well. And then after all that's done, you tie up the bag and you place it in a pre-designated area, and you notify your supervisor, and your supervisor will arrange pickup from OSHA certified biohazard people that come and pick up the bag. And it's very important that as emergency first responders, you have all proper vaccinations and other things required by OSHA, which your supervisor will provide to you. And it's very important that you make sure that that injured person has filled out an incident report form. If it's not before they go to the hospital, after they come back from the hospital, it's very important to have an incident report form on file so that if workman's comp needs to be involved or anything like that, all the paperwork's there and taken care of. And as emergency first responders, that's all you have to do.